Inflammation is the other side of the moon of the immune system. In the previous case, allergy, we had Th2 upregulated. In inflammatory diseases, we have Th1 and Th17. Since Th1 and Th17 are overexpressed, they are producing not more the right quantity of these poor cytokines, but plus. Too much. Is the plus responsible of inflammatory signs and symptoms. These are the main cytokines involved in inflammatory diseases. We are going to study them very, very deeply, since our research is based mainly on diseases which are inflammatory diseases. We will know everyone very well.
Can I ask a question?
Absolutely.
What role does Treg play in your last two slides? Do you know when Th1 is high and the Th2 is low, and vice versa?
Okay, yeah, absolutely. You can have two events, two cases. First, you have a down regulation of Treg. So both Th1 and Th2 are overexpressed. Or, other case, Treg are working normally, okay? So they are in the condition, through especially TGF-beta, to downregulate Th1, but the trigger of inflammation is so strong, for instance, a very severe infection, that even though you have a good control expressed by Treg, Th1 are obliged to work too much. Why? Because a lot of viruses, a lot of bacteria, or a very strong trauma affected myself. So, the overexpression of Th subsets depends by a not good work of Treg or and the importance of the trigger of inflammation. Okay?
And would it help to upregulate Treg? Because you don't talk.
Absolutely yes. You can upregulate Treg or you can downregulate Treg. The concept of up and down regulation can be applied to all the different subsets. Okay? If you need to upregulate Treg, you have to use TGF-beta. If you want to downregulate Treg, I will show you our clinical study on cancer, you must use interleukin 12. So, every time you have one or more than one cytokine to stimulate or to downregulate. We have a scheme, very easy, where you have the so-called opposite cytokine. Okay, this is another picture of the immune system that is typical of your kids with recurrent respiratory infections, chronic tonsillitis. You know that recurrent respiratory infections means that that kid 3-4 years between September and April show over 6 episodes of tonsillitis. And how do we manage that type of kid? Amoxicillin and clavulanic acid every month. So we are raping his immune system. You have to recover the balance. Since those infections are due to a lack in the cell-mediated immune response, we have to push the Th1 answer. And we have to slow down the Th2 immune suppressing activity, Th2 and Treg. Okay, so it's always this concept of recovery the balance. This is the homeostasis I was speaking about. in a healthy condition, all the cytokines, the hormones, the neuropeptides, the growth factors are in a range of concentration that is a precise range, a physiological range of concentration, picograms, femtograms. If you have some cytokines over-concentrated, I mean here, you will have an inflammation. If you have the Th2 and Treg cytokines overexpressed, you will have an immune decline. So have this image of homeostasis as referring point to understand what do we consider as physiological and as pathological. Over or down expression of some cytokines. Our therapeutic strategy will be to recover that physiological concentration. Look at this slide. This is very nice because I have a little animation. In healthy conditions, you have both Th1 and Th2 and Treg cytokines in the physiological concentration. Picograms, femtograms per milliliter. This is, if you make a blood test in this moment from me, I have interleukin 1, 2, 3, 4, blah, 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 here. What happened when a trigger attacked my body? Stress, viruses, bacteria, traumas, I don't know. This concentration disappears and you have an imbalance. Before, excuse me, look here. Before physiological, Th1 cytokines, Th2 cytokines. Disappear the physiological concentration and a pathological concentration appears. You have no more physiological, but over concentration of the red cytokines. It means from Th1, pro-inflammatory cytokines, interleukin 1, interleukin 6 expression. TNF alpha, interleukin 17, if you are facing a patient with rheumatoid arthritis or diabetes type 1. If you have these cytokines overexpressed up, unfortunately you have these cytokines, TGF-beta, interleukin 4, interleukin 10, that we can consider as anti-inflammatory cytokines down expressed. When you have a kid with recurrent tonsillitis, this is the picture of his cytokines. The red ones are down, so Th1 are not working well, so he doesn't have a good cell-mediated immune response front to fight against bacteria. And he has an overexpression of interleukin 4 and interleukin 10 that are, when overexpressed, immune suppressive cytokines. So it's always a balance between Th1, Th2. In this moment, just Th1, Th2, otherwise it's too complicated. It's sufficient to understand what we are going to do now. This is a very important slide. By a methodological point of view, please look at the reference. Cytokine 2014. Cytokine is a journal that is a Bible for all the immunologists. Which is the concept that cytokine wants to express? No good, neither good nor bad in nature. For instance, now I'm going to tell you that interleukin 1 is responsible of acute inflammation. Interleukin 6 is really a bastard anyway. Interleukin 6 is responsible of chronic inflammatory disease. I have to tell you something sad. I will die. It's sad for me, I hope also for you. I will die. And if I don't have a crash with my car, if I don't have a contact with Ebola virus, I will die because of interleukin 6. Interleukin 6 is responsible of chronic inflammatory disease. It is responsible of aging. But the pure interleukin 6 is neither good nor bad. When it is in the physiological concentration, interleukin 6 is absolutely indispensable to activate Th1 to fight against viruses and bacteria. When overexpressed, it is responsible of the chronic inflammation. My skin will become aged because of interleukin 6. So it's important, my friend, that you will consider this concept. Neither good nor bad. They are bad when are here or here. They are good, playing a physiological role when they are in a physiological concentration, picograms, femtograms. Our therapeutic goal will be to recover this space, this range, this homeostasis. We can do that. And this is the most beautiful therapy because you are supporting the self-healing. We are able both to be sick and to be perfectly healed. Self-healing. We address the self-healing through the right words and the right volume. If diseases are expressions, consequences of changed concentration,